care plan for conditions that may influence the patient's ability to be moved or to be positioned. Next is to perform hand hygiene. Next is to identify the patient and explain the procedure to her. Okay, ma'am, my name is Janella Reyes, your nurse for today. May I ask your name, ma'am?
April ng peligro po.
How about your birthday po?
April 26, 2000.
Okay, kamusta naman po kayo, ma'am?
Okay na naman, please.
Okay po. So, next is to assess for tubes, intravenous lines. Usually, it's put here or in the other hand. Next is for incisions, equipments that may alter in the transferring of the patient. Next is to determine if the patient can assist you. You can use or obtain devices, lifts, or caregivers if needed. By assessing the patient's capability to assist you is to let her hold your hand and press your hand. Okay, ma'am? Press my hand. Next is to let her contradict the force that you will be exerting in her feet. Mami, kontram lang yung sa pang idulong ko. Okay, so as I have observed, she can assist in the transferring. Next is to apply clean gloves if necessary. Then lower the head of the bed until the patient can tolerate. Next is to ensure the locks of the bed. Then after that, you can now raise the bed as the same height as the stretcher. Assuming that this is the bed and this is the stretcher, they should be on the same height. And then lower the side rails. Next is to cross the patient's arm into her chest. Next is to move her chin into her chest. Next is to cross her legs.
Next, we will now put a draw sheet under the patient if one is not already there, but assuming that this is the draw sheet, and we will fold the sides of the draw sheet. Next, log roll the patient in the count of 3 in a smooth motion. 1, 2, 3. And we will now put the slide board and gently roll the patient back. After that, we will position the bed next and parallel to the stretcher. And reposition the nurses appropriately. In the first, nurse will stand on the side of the bed where the bed is and the patient, and the two nurses in the side of the bed without the bed or the patient.
Okay, so in the signal given by one of the nurses, which will be Christine, in the count of 3, we will already transfer the patient to the bed. So we are going to reach for the fan-folded sides. Then Nurse Christine will give us the signal in the count of 3 to lift the patient.
1, 2, 3.
1, 2, 3.
Okay, so next is we need to log roll again the patient to remove the slide board underneath the draw sheet. 1, 2, 3. Then gently roll the patient back to the stretcher. Next is we're going to realign the patient to the center of the stretcher. Okay, ma'am, i-realign mo na. So, after we had ensured that the patient is already in the center of the stretcher, we are going to raise the side rails. Then, we are going to fix the pillow under her bed. Then, we are going to raise the head of the stretcher. Then, we are going to cover our patient with a blanket if necessary. Lagyan na po natin kayo ng blanket. So, after we had already ensured that the patient is safe in our stretcher, we can already remove our clean gloves if we had any. Then, perform our hand hygiene. After that, we are going to document any observations that we may have observed during our transfer, and of course, we need to ask the patient if he or she is feeling okay. So, ma'am, had kayo itong ulaw? Nagkisakit ti ulo yung ma'am? So, ensuring that our patient's condition is okay, we can already document those observations, and we had successfully transferred our patient to the stretcher.
Okay, so that's it for today's video. Thank you.